indeed. I'm here this time to, it's a bit different from my previous appearances here. I'm here very much to speak on behalf of the Secretary-General on the aspect of the United Nations system's preparedness for influenza pandemics, and to put that in the context of the ongoing outbreak of Influenza A H1N1. I am not obviously going to talk about the actual outbreak itself, because the work on that is being done by the World Health Organization, and they have been doing regular briefings on this, and they are the people who have the science. But I did think it was useful and to do what the Secretary-General asked me to do, which was to be with you to address the question of how the UN system is getting itself prepared for a possible pandemic, because that would then mean that if he is with you, that he wouldn't have to answer questions on this issue, because he would know that I have answered at least some of them. And I wanted to start by saying that the work that we did since 2005 on avian influenza, and then preparing for a possible influenza pandemic as a result of the H5N1 avian influenza virus, has proved to be very helpful as we now find ourselves having to get into gear to deal with a possible pandemic associated with another influenza virus. What we've done is we've obviously put in place various committees and bodies that cut right across the whole UN, but also what we've done is to be reaching out to and engaging with other organizations who themselves have been having some focus on pandemic preparedness, like the International Federation of Red Cross and Red Crescent Societies, like a number of business organizations, like many non-governmental organizations. And then as we look at the whole scope of our UN family, together with our friends in the World Bank and the IMF, we've got access into financial regulators, tourism organizations, travel operators, airport managers, and those organizations and bodies that are concerned with food, agriculture, and humanitarian relief. This work has enabled us, therefore, to have pandemic preparedness plans in all the different parts of the UN system, in our country offices, in our peacekeeping missions, as well as in the different agencies, funds and programs that work in the UN. And those preparedness plans have been kept up to date and recently reviewed by the Deputy Secretary-General's Committee on this issue. And it's during the last 2 weeks that we've actually said to people, hey, get out your pandemic preparedness plans and just check that they are still valid, make sure that the assumptions you made are still correct, make sure you've got yourselves up to date, talk with your local authorities and national authorities to see that you are well positioned to be able to assist them, and make sure that if this Influenza A H1N1 outbreak turns into a pandemic, even if it's a relatively mild pandemic, that you are ready to support the government, to support the institutions, to keep your essential services going, and to keep your staff as safe and as healthy as possible. So that work's underway. It's going, in our judgment, reasonably well. We obviously don't know how the situation is going to evolve. On Friday, the Secretary-General spoke with staff. You will have heard that he had I think it was called a town hall meeting, Maria? A town hall meeting here. Deputy Secretary-General, spoke with staff, had a town hall meeting, which we were very closely involved in, and our head of medical services was involved in that briefing. I mean, we are in an interesting situation in that we are, the outbreaks of the disease are actually quite strong here in New York State, so therefore it meant that there was a lot of interest of staff in what the Deputy Secretary-General had to say and what our Head of Medical Services had to say. And then today, the Secretary-General spoke to the General Assembly. The President of the General Assembly presided over the event. He gave a talk, and very importantly, Dr. Margaret Chan came on board from Geneva and spoke about some of the work that she's doing, and indicated how when the Secretary-General attends the World Health Assembly in a couple of weeks' time in Geneva, that Margaret Chan and the Secretary-General will be working with countries, with some businesses and others, to try to make sure that they are working in the most effective way possible.